Hello and welcome. My name is Nuno Miguel Vigario. I'm an osteopath and have been practicing osteopathy since 1996. In 1996, I became familiar with the bioresonance therapy or bioresonance therapy form through a colleague of mine at the time, and since 2011 I have been working for the company Medtronic, who makes Mora bioresonance devices. First, let me thank Mora Turkey for inviting me to speak to you all today. Unfortunately, due to the unfortunate circumstances we're in, we cannot be there live, but I hope that my video is enlightening. In 1974, Dr. Franz Morel postulated, based on the information that all substances have a frequency, and all organisms have a frequency, postulated that if we applied an inverted frequency to the existing frequency with the same amplitude, that we could neutralize said frequency. To this effect, he called upon his son-in-law, electronic engineer Eric Russia, to build him such a device. And at the time, they were working closely with Dr. Reinhard Voll, who was a leader in his field in electronic acupuncture, or the measurement of EAV points on the hands and feet using the traditional Chinese method. And as such, in 1976, Morel and Russia, the inventors of classical bioresonance therapy, postulated a weak, low frequency electromagnetic field between 1 Hz and 1 million Hz in a human organism that was considered to induce important regulative functions. It is historically interesting that at the same time, Professors Pop and Ruth rediscovered the biophotons, an electromagnetic regulation field in the optical frequency range. In the endogenous form of bioresonance, the postulated oscillations are picked up by means of hand and feet electrodes, and after electronic inversion are transmitted back to the body for therapeutic reasons. Within the exogenous form, the postulated oscillations of bioactive substances are transmitted after an electronic inversion or amplification for therapeutic purposes to the human organism, such as allergens. For about 40 years, the exogenous bioresonance therapy has been used for therapy with children and adults all over the world suffering from allergic diseases, bronchial asthma, allergic rhinitis, eczema, etc. As a summary, and for the evaluation of clinical results in bioresonance therapy reports, we have the following literature available: 12 non-controlled and 5 controlled clinical studies, which give clear evidence of the clinical effectiveness in allergy therapy with children and adults. These trials were carried out by physicians and scientists in universities, hospitals, and medical practices all over the world. The non-controlled therapy studies: prospective, no anti-allergic medication or avoidance of allergens during treatment. Clinical symptoms were assessed before and after treatment, sometimes immediately, sometimes up to 1 year later, from the patients or the physicians. The results: in summary, the 12 studies with 1,471 patients show an effective rate of 59.3% to 94.6%, and a response rate of 73.2% to 97.5%, depending on the specific indication, patient's age, and duration of the disease. Some of the authors emphasize that the standardized regime of bioresonance therapy works better in children than in adults, and better in acute than in chronic cases. No side effects were observed. In conclusion, all the authors of this non-controlled study consider the bioresonance therapy to be clinically effective and worth applying, especially on children, owing to the lack of side effects. Later, in 1997, Chevniskaya performed controlled therapy studies with two groups. Group 1 had conventional therapy and bioresonance therapy, and Group 2 only conventional therapy. The conventional therapy being glucocorticoid therapy and antiallergenics, etc. The groups are identical regarding indication, sex, and age. The indications: allergic and respiratory diseases. The clinical symptoms were assessed before and after treatment. There were 101 participants between the ages, adults between the ages of 30 and 50 years old. With regard to the control group, bioresonance therapy shows better therapeutic results in a shorter time and a reduction of the used medications. The author's conclusion: the clinical effectiveness of the bioresonance therapy is better than the conventional therapy and has no side effects. Yang, in 2004, a prospective therapy study with two groups. Group 1, solely bioresonance therapy, and Group 2, conventional therapy only. This included glucocorticoid therapy, antiallergics, according to the GENA concept. The groups are identical in age, indication, and sex. Indications were allergic bronchial asthma. The clinical symptoms were assessed before and 6 months after treatment. The participants, 300 children between the ages of 2 and 15 years old. The success rate of the bioresonance therapy group was 85.4%. The conventional therapy, 75.8%. The author's conclusion: the clinical effectiveness of the bioresonance therapy is better than the conventional therapy and without side effects. Huang, 2005. A prospective randomized therapy study with 3 groups. Group 1, no anti-allergenics, only bioresonance therapy. Group 2, resistance to therapy so far regarding anti-allergenics. To this group, no anti-allergenics were given and bioresonance therapy applied. In Group 3, only conventional therapy was applied, glucocorticoid therapy, antiasthmatics, etc. Group 1, the bioresonance group, had a success rate of 85.7%, whereas Group 2, the therapy resistant, had a success rate of 79.6%, and Group 3, using only conventional therapy, 69.1%. The groups were identical regarding indication, sex, and age. Indications were allergic rhinitis and allergic bronchial asthma. Clinical symptoms were assessed before and 6 months after treatment. The participants were 172 children between the ages of 1 and 15. Author's conclusion: bioresonance therapy had no side effects and is at least as clinically effective as the conventional therapy. It is recommended especially for children that have no conventional therapy success. The 12 non-controlled studies containing 1,471 patients and the 3 controlled studies having 573 patients in total are unrestrictedly positive according to the author's report. 2 controlled studies containing 83 patients had been evaluated negative according to the author's conclusion. However, in these reports there is some evidence of the clinical effectiveness of classical bioresonance therapy. Particularly remarkable in the results is a clear and strong dependence of the effectiveness with respect to the age of the proband in the trials. The younger the proband, the higher the effectiveness of the bioresonance therapy. In summary, the greater majority of the performing scientists and physicians believe, on the basis of their investigations, that the non-invasive classical bioresonance therapy is clinically effective and worth applying in allergy therapy for children and adults. Furthermore, in no trial were side effects observed. The process of applying or assessing bioresonance therapy for allergies is a relatively simple one. Most patients, around 90%, are already pre-diagnosed with their respective allergies. We need but take the frequency of said allergen, either from the device or in native form, and apply therapy. Therapies range between 15 and 25 minutes and are applied once a week. Therapies can range between 5 and 10 sessions, depending on the patient and the length of the disease. Moreover, therapy blockages can occur, especially in the case of nicotine abuse, carbohydrate abuse, and alcohol abuse. In these cases, the therapy may extend longer or result in therapy failure if the patient does not comply. Over the years, I've been asked, are we curing allergies? My answer is generally no. We are creating tolerance or building up tolerance to the allergen, to the point where when the person comes into contact with their allergen or their allergy, they no longer display symptoms, or at the very least reduced symptoms, significantly reduced. Another question I get, or statement, is that bioresonance is the future of medicine. I wholeheartedly disagree. If anything, bioresonance is a complement to modern day medicine, a tool in order to facilitate our patients, make our patients feel better with no side effects. I thank you for your time. Thank you for listening. Stay safe. Stay healthy. Bye-bye.